So you've had extensive experience on the Baylor Scott and White board. Can you talk about how the organization and board has changed in your time there?
Well, we brought Baylor and Scott and White together in 2013, which is 8 years ago now. And they were two very like organizations, and yes, yet they were diverse. Scott and White was based in Temple, Texas, a more rural town in Central Texas, and obviously Baylor was based here in Dallas. And so we brought these two philosophies, but they both had a Christian basis and a Christian healing basis, and so we were able to build on that and on practicing good medicine to bring the best of both organizations together.
So talk about the process of the board in selecting Jim Hinton as CEO in 2016 and what that taught you about succession planning.
We started looking for a new chairman, a new CEO in about talking about it really when we merged, because we knew that Joel Allison he had told us he was only going to stay 2 or 3 years after that. And so we actually were talking about it for a long time. You always look at your internal candidates and you want them to always have a chance. Sometimes when you have a group that has for a long time, which in the case of Baylor for a long time, you'd had the same type of succession planning. The president gone to CEO, and the head of operation had gone to president, and so it went on. And so we looked both inside and outside. We interviewed 8 very outstanding people from across the country with internal candidates as well, and came up with somebody that had a wealth of knowledge. He'd been CEO. None of the people that we interviewed had been CEO of a comparable organization, and 3 of them had been CEOs. But we found one that had been with the same organization for continuity's sake for 25 years as CEO, and it worked really well for us.
So you've had an extensive experience in finance, oil, and really philanthropy before this. How did all that make you a better board member for Baylor Scott White?
Well, the one we left out is ranching, and I think that's the one that's most important in what you do, because you learn common sense there. You can look at things in banking on paper, and you may think they work. You can look at things, in lots of different ways, and you may think they work. But in ranching, where everyday decision is a matter of very important to the animals that you are taking care of, then you've got to make sure that even though it may look good on paper, you got to make sure that it relates to reality. And so that's what it takes. To me, that's what it takes at Baylor Scott and White, or at any great not-for-profit. You have to use common sense. Yes, you have to have knowledge of what you're doing, but if you have all the knowledge in the world and no common sense, it won't work.
Talk about Baylor Scott White's strategic shift to digital health solutions and what that allowed the organization to do the last year as the pandemic took hold.
We were already on our way to digital health. We were fairly far down the road, okay, compared to other organizations, and yet we found out how we really worked, okay. One of the problems is because the insurers did not want to pay for virtual visits, and so that's one of the things that a hurdle that we had to get over, and so they soon did. But we have an app called that for your phone that's called My Baylor Scott and White Health, and we were able to leverage that app into asking questions around the COVID crisis, and people were concerned when they had this, when they had that, and so we had a set of questions that was on that app, and if they went after answering the questions, if they still felt like they needed to see a professional healthcare person, then we set up a virtual visit. All of this is free to them. All free to the patient. We set up a virtual healthcare visit with them to see a practitioner, and we went from about 368 or 70,000 initial people that filled out the application to about 80,000 people that had a virtual visit. And we tested, and I don't remember exactly how many we tested, but it was probably 10% of those that went on the virtual visit. So we kept from loading down our facilities at a time that we were trying to test an awful lot of people. And that's what digital medicine did for us and how it got us through and really in great shape. In the Dallas. It was really interesting to find that one time the CEO called me, Jim Hinton called me, and he said, "Ross, I'm not real sure what to do." The governor just came on TV and said that in Texas, we were only able to do X number of COVID tests. He said, "I don't want to question the government, but we're doing 6 times that at our lab in Temple." He said, how do I tell that story? And I said, well, call the governor's staff and tell them that you'd like the governor to call you and to see what we are doing. And that way his information is more up to date. He was just getting bad information because in all candor, we were leading not just this state, but many states in COVID testing and in digital health. And this was the time for it. And now I might add nearly all of the insurance companies, I think all of them, have added a virtual visit to their pay schedule. The one thing I'm having a lot of trouble finding is people to bring youth in. Okay, we're all getting a little long of tooth, and how do we bring a group in that are 40 years old instead of a group in that are 60 years old? And then they end up maturing like myself, and you end up being too old. And so it's very hard to find that person that has the time, has the effort, has the maturity, and has the knowledge to be a great board member. But the diversity of youth, the diversity of thought is the hardest thing to find.